16 children who are severely ill or have been injured in the war in Gaza have been evacuated through the Egyptian capital of Cairo to receive treatment in Spain. It's the first time the European Union has financed or coordinated such evacuations since the war broke out in October. While humanitarian experts welcome the move, they say much more needs to be done to prevent the devastating loss of life among children in Gaza.
Evacuations are needed, they're vital. There is no access to healthcare in Gaza. So at least we're glad that 16 children can get the medical care they need. But I know that, first of all, there's 20,000 children missing in Gaza. We have tens of thousands injured. So this number is not only a drop in the ocean. We need to evacuate hundreds on a daily basis to be able to actually save some of the children in Gaza.
The evacuation was supported by the EU's civil protection mechanism, following a request from the World Health Organization. Brussels first asked EU countries to receive patients from Gaza back in May. The EU executive says only 7 of 27 member states, Belgium, Italy, Luxembourg, Malta, Romania, Slovakia and Spain, have offered to treat or assist the transport of patients so far. Humanitarian organizations say that while evacuations can support some children, more aid needs to urgently flow to Gaza to give children who are experiencing a living nightmare a chance of survival.
The needs on the ground in Gaza after so long, after more than 9 months, are so massive that what needs to happen is for more consistent and sustained aid and entry of aid into Gaza, and not just that aspect, but for it to be effectively distributed to all areas of Gaza where civilians are living, where people have received evacuation orders, where hospitals and healthcare facilities have had to stop functioning because they've lost staff or they're out of supplies.
There are fears the humanitarian crisis in Gaza is being compounded by famine, as well as the potential spread of the highly infectious polio virus. The disease was identified in samples of sewage, with non-vaccinated children most at risk.